In 2017, Grand Rapids, Michigan had a population of approximately 200,000, about 60% Black, 20% white, 0.4% American Indian/Alaskan, and 2% Asian. Socioeconomic status can greatly impact one's health outcomes. In 2012 to 2016, the high school graduation rate, or high, of a person's age 25 years or older was 85.4%. Percent of residents in Grand Rapids that are in poverty is 25.1%. Household income in 2016 was $42,000, and unemployment rate in Grand Rapids was 2.7%. A current issue that's affecting Michigan is obesity. Michigan ranks 16th nationally with the most obese states, which in 1995, Michigan was ranked 4th, estimated that 31% of adults were obese in 2015 compared to 13% in 1990. Minorities such as Black and Latinos have higher rates of obesity than whites at 38%, 37%, and 30% respectively. A public health concern because obesity causes many negative health effects such as diabetes, cardiovascular disease, and hypertension. Another public health concern is opioids use in Kent County. In Kent County, 2015 marked a 5-year high in overdose deaths. In 2016, it could be on track for more. 2015, there were 32 deaths caused by a heroin overdose compared to 19 in 2015. The RED Project is a part of the overdose prevention efforts and has given Narcan kits to the public. Since 2008, the drug is responsible for 394 overdose reversals, but the distribution efforts is still not enough. Overdosing and addiction is a public health problem because more and more people are dying every year. Prescription drugs are being overly prescribed and people are taking advantage of them. This can cause a rise in crime rates as well as more emergency room visits and healthcare spending increasing. Many health-related factors that affect Kent County, Michigan include adult smoking. In Kent County, prevalence of adult smoking is 16%, although in 2007, the prevalence of youth smoking in Michigan was 18%. Prevalence of obesity in Kent County is 29%, and a negative health outcome associated with obesity is diabetes, which 9% of adult population have. Also, HIV prevalence in Kent County is 175 per 100,000. Other health-related factors that disproportionately affect Kent County is access to primary care providers. The ratio of population to primary care providers is 1,120 to 1. The opioid epidemic is a growing crisis every year in the United States. More than 115 people die from overdosing every day. Opioids, commonly known as narcotics, help with pain management and are prescribed for many reasons, including a major injury, surgery, chronic pain, and cancer. Opioids can be highly dangerous to one's health and possess many negative side effects, including tolerance, dependence, and increased sensitivity to pain, constipation, nausea, vomiting, dry mouth, sleepiness, dizziness, confusion, depression, low levels of testosterone, and itching and sweating. The increase in opioid deaths can be seen in 3 different waves, beginning in the first wave in the 1990s, the second wave in 2010, and the third last wave in 2013. Over 350,000 people have died throughout these 3 waves from 1999 to 2016. The first wave in the 1990s, which was attributed to the increase in prescription opioids that led to overdose deaths involving natural and semi-synthetic opioids as well as methadone. The second wave in 2010 was due to a sharp increase in heroin use causing many to overdose. The third and last wave in 2013 was significantly due to overdose involving synthetic opioids like fentanyl, which can also be seen in a combination with heroin, counterfeit pills, and cocaine. Greater rates of opioid use began in the late 1990s when laws governing prescription opioids had fewer constraints for non-cancer treatment, which led to a greater increase in opioid prescription. Opioid use rapidly took off when Purdue Pharma created and manufactured OxyContin in 1995. The following 7 years, Purdue funded over 20,000 educational pain-related programs and long-term opioid use campaigns for chronic non-cancer pain. In 2000, the Joint Commission on Accreditation of Health Care Organizations devised a new pain management standards which increased the awareness of a right to pain relief. Pharmaceutical companies reassured the medical industry that the opioid use were safe and possessed no adverse health effects or addiction when prescribed by physicians. Of those who prescribed opioids for chronic pain, about 21 to 29% of them misused them, and 4 to 6% of those who misused them transitioned to heroin. Non-medical prescription opioid misuse remains a crisis in the United States, and in 2010, nearly 2.4 million Americans were using opioids for non-medical use. there have been a threefold increase in the opioid use, as well as drug poisoning deaths in rural counties across the country. There are several reasons for the increase of opioid use seen in rural versus urban communities, such as economic deprivation, inequality, family dynamics, unemployment, and social pressures. On average, rural areas oftentimes have an older population than urban areas, which means more health conditions and chronic pain, leading to increased opioid prescriptions. The heroin crisis continues to rise year after year, placing enormous amounts of threat on the U.S. population and economy. Heroin is extremely addictive and deadly, and 80% of those who experience heroin have previously misused prescription opioids. In 2016, more than 15,469 people died from a heroin overdose. Opioid overdose deaths are often unintentional and accounted for 78.3% of deaths in 2010, which outnumbered motor vehicle deaths. Men are twice as likely to chronically use opioids for non-medical purposes and die from overdosing than women, even though opioids are prescribed more oftentimes to women. Prescription opioid abuse poses extensive economic burdens each year, resulting in over $72 billion in medical costs due to medical substance abuse treatment, loss of reproductive, and criminal justice costs. The intention of the POINT program in Toronto, Canada is an overdose prevention and response training program that also dispenses naloxone. The three goals of the program is to decrease opioid overdose deaths in Toronto, increase appropriate responses to overdose among opioid users, and to decrease non-fatal opioid overdose events through prevention education. Posters and flyers are hung at participating locations to help advertise the program, as well as media coverage, word of mouth, and mobile use exchange. The intervention point provides opioid overdose training to clients one-on-one, in small groups, and on a drop-in basis. Nurses or counselors from the works deliver a 20-minute training session to clients who must complete the curriculum and knowledge assessments before they are able to obtain a naloxone prescription. There are various programs that are similar to the POINT program, which have been successful. In 2014, there were 644 local opioid overdose prevention programs among 30 states and Washington, D.C. that provided community members with naloxone kits and training on how to use them. There are various underlying causes of opioid overdose. One of them main causes is a rural community. In 2015, there were 17 per 1,000 overdose deaths in a rural community compared to 16.2 per 1,000 in urban areas. A sub-cause due to a rural community is unemployment. The POINT program would target the older population in hopes to educate them and distribute Narcan kits because the older population is at a higher risk of death due to opioid misuse. Poverty is another factor which this program will help target those, and by providing free Narcan kits. Lack of access to quality care is another sub-cause in a rural community. This program uses healthcare units to reach the population program who cannot access them. This program would target members of close social groups, thus influencing the rest of the group to become trained and educated about Narcan and opioid prevention. This intervention is a good fit for Kent County because 2015 marked a 5-year high for opioid use. HIV prevalence is high and opioid use contributes to the increased rates of HIV. Also, pregnancy, teen births, and infant mortality are affected by opioid use. Youth and adult smoking rates in Kent County are important to consider because smoking causes you to have an addiction to nicotine and to become dependent on it, which can lead you to try other substances such as opioids and become addicted. Kent County Health Department would be beneficial for the implementation of the POINT program because they have 4 clinics throughout the county, giving the community greater access to the intervention program. They have public health nurses that are readily available on site that would be able to train clients before giving them naloxone prescriptions. The RED Project is another great partner for the POINT program in Kent County because it is a similar program that already put in place to deliver naloxone prescriptions to individuals, family members, and friends who want to be prepared if someone they know is at risk. Facilitators bringing these partners together would be health department administrators, such as the administrative health officer, medical director, community clinical service division director, and overdose prevention and programming director. Thank you so much for watching my TED Talk. I hope you enjoyed.